Today we are going to discuss a very short topic, and that short topic is the first carpo metacarpal joint. Okay, there are many, all of us know that 8 carpal bones, and now we are just discussing the first carpo metacarpal joints. Okay, we know that there are 2 rows of carpals from lateral to medial side: scaphoid, lunate, triquetral, pisiform. Okay, she looks too pretty. Trapezium, trapezoid, try to capitate and hamate. Trapezium, trapezoid, capitate, hamate. Okay, so on the lateral side is the thumb. So this trapezium, which is on the lateral side, trapezium, makes a joint with the first metacarpal. Metacarpals are always numbered from lateral to medial side. Okay, then here will be the other metacarpals. Okay, so the trapezium makes a joint with the first metacarpal, and this joint has a lateral ligament. Of course, there is a capsular ligament which will be surrounding the joint. The first will be capsule. Then there will be lateral ligament. There is an anterior ligament, and a posterior ligament. Okay, there will be posterior. So total, there is capsule, anterior ligament, posterior ligament, and a lateral ligament. We are talking about right now the thumb. We are talking about this joint, the first carpo metacarpal joint. And why we are talking about this joint? Because this joint is a joint of saddle variety, multi-axial. It's a multi-axial joint. Okay, multi-axial joint of synovial type and saddle variety. Okay, it's a saddle variety, multi-axial, and it's a synovial type of a joint. Okay, it has the articulating surfaces are 2. One is the distal surface of trapezium and the base of the proximal part of the base of the first metacarpal. Base of first metacarpal. Okay, these are the articulating surfaces. There is capsule. Okay, the capsule like this. Then there is anterior ligament, posterior ligament, and lateral ligament. Okay, the relations of this: anteriorly covered by the muscles of the thenar eminence, and posteriorly there are the long and the short extensors of the thumb. Okay, the blood supply comes from the radial artery or from the radial vessels, and the nerve supply comes from the median nerve. The most important part of this is the actions, because it's a multi-axial joint, so it will have many actions. So this action is flexion, this action is extension, flexion, extension. Then there is abduction. So abduction, adduction. So the plane of abduction and adduction is perpendicular to the plane of flexion and extension. So for these joints, this is abduction and this is adduction in relation to the, always in relation to middle finger. Movement away from the middle finger is abduction, towards the middle finger is adduction. And the flexion and extension is like this. For the remaining 4 digits, for thumb, for remaining 4 digits, the flexion extension is this plane. But for the thumb, this is abduction and this is adduction. Okay. And this is flexion, this is extension. And there is one more action called as opposition, where the thumb touches all the 4 digits. So this is called as opposition. This action is called as opposition. Okay. And of course, this we don't talk it as circumduction, but then totally there are 5 actions happening at this joint. One is flexion, okay, which is brought about by flexor pollicis brevis and opponens pollicis. Okay, Then there is extension. Extension is brought about by abductor pollicis longus, extensor pollicis longus, extensor pollicis brevis. Abduction is brought about by abduction, abductor pollicis brevis and abductor pollicis longus. Okay. For adduction, so basically you have to just remember, for abduction, abductor pollicis; for extension, extensor pollicis; for flexor, flexor pollicis; or for opponent's pollicis is also there. For extension, there is abductor pollicis longus. For adduction, there is only one muscle, adductor pollicis. There is no longus and brevis in case of adductor pollicis. For opposition, there is a muscle, special muscle, opponent's pollicis. Okay, opponent's pollicis and flexor pollicis brevis. Flexor pollicis brevis. Okay, so flexion. This is flexion, which is brought about by flexor pollicis brevis and opponent's pollicis. Also, flexor pollicis longus also help. The extension is brought about by abductor pollicis longus, extensor pollicis longus, and extensor pollicis brevis. The abduction is brought out by abductor pollicis longus, abductor pollicis brevis. Adduction, the adduction movement is like this. Adduction is brought about by adductor pollicis, and opposition is brought about by opponent's pollicis, and also because there is a slight degree of flexion also involved. So flexor pollicis brevis. As regards the applied anatomy of this is concerned, nowadays with use of mobile phones, this has become a very important joint, because for using the mobile phones, the thumb especially is constantly being used like this, and this is leading to the inflammation of the first carpometacarpal joint. This is leading to the inflammation of the interphalangeal joint of the thumb. So people complain of pain in the thumb, and that is due to excessive use of media, even excessive use of computer, excessive use of. So we have to provide them rest, or provide them some massage, oil massage, and also a splint sometimes is provided so that the thumb comes out of the inflammation. Now, what about the other joints? Okay, so there are other joints also, and these are the heads of the other metacarpals over here, and this is these joints which are called as metacarpophalangeal joints. Okay, these are condyloid type of joints. Okay, condylar type of joint or condyloid type of joints. Okay, it is biaxial because there are two axes. This is one axis where abduction adduction takes place, and this is another axis where flexion and extension takes place. So these joints, which are the metacarpophalangeal joints, these are condylar variety. These are condylar variety. The interphalangeal joints, these interphalangeal joints are hinge variety because only they are uniaxial. So uniaxial joints of the hinge variety. Okay. So amongst the carpometacarpal joint, only the first carpometacarpal joint is most important, and it is the one which is of saddle variety, and very important joint for us because our eating, our writing, everything we do by this first carpometacarpal joint, which is of saddle variety, which is multiaxial. It's a synovial type of joint. It has a capsule and it has anterior ligament, posterior ligament, lateral ligament. Articular surfaces are formed by the trapezium proximally and the base of the first metacarpal distally. The relations are anteriorly are the thenar muscles, posteriorly are the extensors of the thumb. Blood vessel is from blood supplies from the radial vessels, the nerve supplies from the medial nerve. Flexion is brought about by flexor pollicis brevis and opponens pollicis. Extension is brought about by abductor pollicis longus, extensor pollicis longus, extensor pollicis brevis. Abduction is brought about by abductor pollicis brevis, abductor pollicis longus. For adduction, we have to remember. For extension, there is longus brevis. Even for flexion, there is longus brevis. Abduction, there is longus brevis. But for adduction, there is only adductor pollicis. For opponents, again, there is opponens pollicis and flexor pollicis brevis. With that, we stop. Please do read the first carpo metacarpal joint, which is a multi-axial saddle joint of synovial variety.